Hello, so I'd like to introduce the new locking laterals from Seating Matters. So these laterals are designed to stop the rotational movement in the lateral and to stop the lateral movement sideways in patients. So they are fitted into the same mechanism as the current laterals, and they slide in like this. What we need to watch out for is these holes. They are the receivers. So once we find a hole that we're happy with, widthwise, we can set that into it nice and easy, and you'll actually need to tighten it in a little bit further than normal as such, and then that stops the rotational movement of the lateral and also fixes it from spreading outward. So then after that, all we need to do is adjust the rotation. So again, with a little adjustment knob, you can remove that and adjust it in height. So then once we have our desired position, as such, we can put it in place. And again, if it's still moving around, it's probably not tightened in enough. It needs a little bit of adjustment. You can see that there's moving in a little bit further, and then once it's in place there, that's not moving up or down